As you can see, the DIAGNOcam really does offer much more than other techniques. One of the strongest aspects we have found is case acceptance. You can show patients these images, allowing them to fully understand and see what you're talking about. A successful way to do this would be to identify a healthy tooth structure compared to a not so healthy tooth structure and ask the patient to comment on what they can see. Essentially, because it's such an easy method for patients to be able to relate to, they point to an area of concern and then can co-diagnose the image for you. It's extremely powerful for patients to be able to do that and gives them the visual confirmation they need to then go forth with the treatment plan that you have set out. This is just a short video of the image you can expect to see in live time, so you can video the DIAGNOcam image. You can rotate it around so you can get a better indication of the lesion depth, cracks and fractures. Feedback we've had from practices is patients feel more informed and involved. They like the visual confirmation of what you're saying and the fact it can be used to monitor patients' treatment without having to use radiographs. We've even heard of patients returning to the practice saying, "Hey, you know that cool tool that you used on me last time? Is there any chance you can check this tooth out for me? Because I'm having a bit of sensitivity." So patients are asking for this technology instead of having an X-ray taken. And of course, early detection. We spoke a lot about lack of early detection in radiography and how successful the DIAGNOcam is. We've all had the same cases where interproximal decay has been so hard to diagnose because we've had overlapping cusps of sizable restorations in the way. With the DIAGNOcam, we can now see these areas and diagnose them much earlier. You can also use it as a selling tool to your patients and advertise to them in your waiting room. Explain to them that you have this tool. You can use it on them at their next appointment and use some of the promotional material via Cavo. I'll just quickly run through the physical DIAGNOcam and how to use it. It literally is a standard USB connection that can go into your computer or laptop. It also gives practices the flexibility to have it on a trolley or into the computer tower behind them. Because the cable is 2.5 meters long, it's got relatively large reach. You can also select the type of tip you want, either a large tip or a small tip, depending on the patient's size. You hold it like an intraoral camera, and the capture ring is on top of the camera. How I like to demonstrate it is to roll it over the patient's tooth from the lingual or palatal aspect first, and then ensure the arms are seated nicely around the gingival margin. This then provides nice translumination. If it's not seated correctly, you get quite a bright image, so it needs to be seated a bit further down. Use it like an intraoral camera, roll it over the tooth and then just really look in for what you can see and simply squeeze the capture button. Once you have used the DIAGNOcam, the tips are removable. They can then be disinfected and then sterilised in between patients.